Alright, hello everyone. Today we're going to be going over the axial skeleton. In this particular video, we're going to be going over the skull, and there's a big reason for that. So when we talk about the axial skeleton, we mean the skull, the vertebral column, the sternum, and ribs, but we don't include the appendages or the appendicular skeleton. Now, the skull in particular is very difficult to memorize, especially for beginning students. The skull has many parts, as you can see here. It looks like one bone or two bones as per the mandible, but it's really many bones held together by sutural joints or fibrous joints. Now, best way to start learning is the outside bones. And right here, we can start with the parietal bone. This is a bilateral bone, so there's two, one on each side. And then we have the frontal bone, there's only one. The nasal bone is bilateral, so there's one on each side. There is this sphenoid bone here. Remember, this is a right lateral view, so it's going to look different throughout the other different views. Then we have the temporal bone here, which is bilateral. And then the occipital bone, that's one bone right here. And you can kind of imagine how, like, this is bilateral, and this could be only unilateral or only one. Yeah. And then we have the zygomatic bone here, which kind of makes the sides of your face. And then we have the maxilla over here, which makes up the top roof of your mouth and part of your nose. And then looking further here, we have the lacrimal bone. Lacrimal meaning tears, so where your tears would be secreted. Then we have the ethmoid bone, which is the base of your nose, facing more posteriorly. All right, and next, it's important to know the sutures. Now, there are more complex names for the sutures, but it's important to remember the main sutures here. So right here, we have the coronal suture. Remember, coronal means the frontal plane. So if you slice this guy down like that, that would be the coronal plane. So we call this the coronal suture. Now, this one wouldn't be called the transverse suture. It would be called a squamous suture here. So it aligns a parietal and temporal bone, or forms a junction between. Over here we have the lambdoid suture, and if you were facing this guy's skull posteriorly, it would look like a lambda symbol, you know, that symbol using chemistry and physics. And then we'd have the sagittal suture right here, which cuts this guy sagittally. So we have a mid-sagittal cut down the sagittal suture. Now, there are a lot more sutures, but these are the main ones you should be able to memorize. All right, let's go over the processes. Now, processes are a prominent protrudence of a bone, and they usually serve as connection points for ligaments. And right here we have, now this is going to be confusing, but we call this, even though it's part of the temporal bone, it faces towards the zygomatic bone. So we call this whole thing the zygomatic arch, but this particular purple part we call the zygomatic process of the temporal bone, or just zygomatic process. And conversely, facing or with the perspective with respect to the zygomatic bone, this is the temporal process of the zygomatic bone, or just the temporal process more simply. All right, and then we have the mastoid process. So directly behind the mandibular condyle, you can kind of feel it in your head. So it's right behind your ear. Now, next one, styloid process, you can't really feel. That serves as the attachment point for a lot of the mandibular muscles and ligaments. And the styloid process, it kind of looks like a stylus, so that's what we call it, a styloid process. It's an extension of the temporal bone. And we already talked about the zygomatic and temporal process. Now, there are a lot more processes in the skull and the body, but these are the main ones on the outside, external view. Now, another important thing to know for the skull are the fossas and the foramina, meaning holes, and fossa meaning bowl. So the lacrimal fossa is, I think, is the only fossa of the skull, and that's just this little depression here in the lacrimal bone. Now, getting started with the foramina, we can see the external acoustic meatus, and that's where the auditory canal, or where the sound would go in to hit your tympanic membrane. And then next we have the mental protuberance, the mental foramen right here. And that hole, there's nerves that pass through there. And that's all the foramen we can see from the right lateral view. So let's move on to the anterior view of the skull. And this is where things get more complicated. So I encourage you guys to study this more because it's going to get very complicated very fast. Now, uh, immediately you can see a bunch of holes here. And now focusing just on holes and not the new stuff here, we can see that this is a supra, meaning above, and then orbital, meaning the orbit or the part of the eye. So supraorbital foramen. Now, not everyone will have a supraorbital foramen. Some people will have half a foramen, and we call half a foramen a notch. And this is bilateral. And then we always have an infraorbital foramen on the maxilla here, frontal bone maxilla. So infraorbital foramen. And then you probably won't be tested on this, but this is a zygomatical facial foramen. It sits on the zygomatic bone, and it's on the face. And then right here we can see the bilateral mental foramen, as we already discussed before. Now, another foramen you can see here is the optic canal, and then you can kind of deduce that the optic nerve runs through there, and it's bilateral, of course. So we can either call it the optic canal, optic foramen, since the nerve runs, or the hole runs really deep through and into the skull and attaches to the brain. Now over here we have a fissure, not really a foramen, but we'll go over it anyways. Now this fissure is known as the supraorbital fissure because it's above the infraorbital fissure here. Okay. And now we'll move on to the inferior anatomy of the skull. And this is probably the second hardest to learn, but we will get over it. Now, looking here, we can see more foramina emerge. But first, we can go, from this perspective, we can go superiorly to inferiorly. Right here, we have the incisive fossa. Now, it's called a fossa if it does not go all the way through, the hole doesn't go through. But if it does go all the way through, we call it incisive foramen, because it's more accurate because it's a hole, right? Now we can see the palatine bone, that's a new one. And then this is the palatine process, because it's part of the maxilla, but not part of the palatine bone. Okay. And then we can see new foramen here. Now this is the foraminal valley, and it's bilateral. The foramen lacerum, bilateral. Okay. And then the foramen spinosum, that small thing right there, also bilateral. And then we can see the external acoustic meatus, like we saw on the right lateral view. And then the jugular foramen right here. And then the carotid foramen, or carotid canal up here. And the largest foramen, we have the foramen magnum. That's probably the easiest to remember. Now the internal skull anatomy is the easiest to look out of the holes. It's easier said than done, however. But I guarantee you it's going to be easier to memorize than you think. Just a 1 hour practice, you can get it down pretty quickly. So don't be dissuaded. Now, foramen cecum, going from this perspective, superiorly to inferiorly, we have the foramen cecum here. That's part of the crista galli. And sometimes we say this is the olfactory foramen since it's a cribriform plate and has many holes. But generally, no, you don't have to memorize that. Then we have the optic canal, which is considered foramen because the optic nerve runs through it. It's a through hole. And you can kind of see over here the supraorbital fissure. And then moving down here, we have the foramen rotundum, part of the sphenoid bone. The foramen lacerum. Then we have the foramen spinosum here. This is actually the foraminal valley, my bad. The foramen lacerum is over here, and then there's a carotid groove that kind of runs. The carotid canal runs up here. The carotid canal runs up here where the foramen lacerum comes out. And then we have the acoustic meatus, the internal acoustic meatus. Remember, that's part of the ear. And then we have the jugular foramen where the jugular vein runs through. And the hypoglossal canal where the hypoglossal nerve runs through. Alright, and that should be it for the foramen of the skull. Now before we go back and learn the other parts of the skull to finish things off, we need to establish some new terminology for the skull. Now, or just in general for the skeleton. Now number one, we have the fossa, which means bowl. It's the receiving face of the joint. So think female end of a joint. You think ball and socket. Now, the condylar or condyle is a cartilaginous male end of the joint. So that's going to be going into the joint. A process is a bony protuberance from bally structure. A cranial suture is a fibrous joint dividing the cranial bones, and they look like cracks or fissures, but they are not. Bilateral means that just basically structures are mirrored on both sides of the mid-sagittal plane. Now let's go back to this model of the skull. Now, the thing with bones is that it isn't just the bone, but there's many regions of the bone that we should be able to remember. Now, a good example or a good place to start off with is the mandible. So let's just get started here. So this part is known as the ramus of the mandible. And this part is where the angle changes. So the angle of the mandible. And then over here we'd have the body of the mandible. And over here, remember, condyle is the male end of the joint, so we call this a mandibular condyle, and then it attaches to the mandibular fossa. And over here, we'd have the coronoid process. All right. And for the new parts, we have the nasal bone, inferior to the nasal bone. We can see some new bones pop up, and they are much harder to remember, except there's one misnomer. So let's start off right here with the nasal septum, which is composed of the voma, which is the inferior part of the nasal septum. And then we have the perpendicular plate, which is the superior part of the nasal septum. All right, and then going laterally from the perpendicular plate, bilaterally, we have the middle nasa conchae, and they're bilateral, and there is no superior nasal conchae. And that's kind of a misnomer because we have below this inferiorly, we have the inferior nasal conchae. There is no superior nasal conchae. And these create turbulence within your nose, so that way you can have and also surface area. So more cells, more goblet cells can be there to produce mucus. All right. And then just looking here, we have the maxilla here. We have the alveolar process of the maxilla, and that's just where the teeth are going to be sitting. So this right here, where there's extensions of the maxilla. And then same thing with the mandible. We have the alveolar process in the mandible. And then we talked briefly about the palatine bone, which is an extension of the ethmoid bone. And then we have the maxilla part of the palatine bone, so just the palatine process, and then incisive foramen, or incisive fossa in the skull. It depends on the skull. Everyone's different. All right. And over here we have the occipital condyle, and that articulates with the atlas, which is the C1, the first cervical vertebrae of the vertebral column. Over here, so that would be cartilaginous and hyaline cartilage, because that's the articulating part. And over here we can see the styloid and mastoid process. You've already talked about that. Over here we have the external occipital crest, less important but good to remember. External occipital protuberance. And then, yeah. So possibly the hardest to remember is an extension of the sphenoid bone. When we have the greater and lesser wings, it'll be easier to see on the interior part, so we'll get to that later. But over here we have the pterygoid processes. Now this is called the lateral pterygoid process, these two, and this is called the medial pterygoid process. And this is the voma right here, that's the inferior part of the nasal septum. Alright, now let's go back to the sphenoid as promised, and we can see this is the lesser wing of the sphenoid bone. These lesser wings, and this is the greater wing of the sphenoid bone. Now some things we didn't go over, we have the crista galli, which is the septum of the cribriform plate here, which is associated with the olfactory nerve. And over here the sella turcica, also known as the pituitary fossa, that's where the pituitary gland sits. There's a lot more parts of this, but it's not very important to remember depending on your class. So if you do need to remember, definitely do remember that. And then we can divide this skull bone into three different parts. We can call this one the anterior cranial fossa, and it kind of runs over here on the lesser wing of the sphenoid bone, and then begins again at the greater wing. Over here we have the middle cranial fossa, and then we have the posterior cranial fossa. So there's that. Alright, and that's pretty much it for the skull anatomy. Again, I encourage you to actually use real models and look up some Quizlets that can help you a lot. Or you can look up encyclopedias. But anyways, I hope this helped you a little bit, and I will see you in the next one. Goodbye.